Hi there and welcome to Radiant Moments, a JB podcast. I'm Michelle, your host, and it's an honour to share this time with you. Before we begin, I want to invite you to pause just for a moment and take a deep breath. Let it fill your lungs and then exhale slowly, releasing any tension you've been carrying. Feel the weight of your shoulders lighten, even just a little. Whether your day has been calm or chaotic, this is your chance to slow down. This is a space where you can simply be. No expectation and no demands. Just you, tuning into a moment of connection and care. As caregivers, our focus is often on everyone else. But here in this podcast, we focus on you. We'll explore the moments that ground us, the practices that strengthen us, and the stories that remind us we're never alone on this journey. So settle in, whether you're listening at the start of your day, on a quick break, or winding down at night. Know that you're part of a community that understands, uplifts, and walks this path with you. Let's step into this radiant moment together and see where it takes us. In our previous episode, we focused on gratitude and reflection in the caregiving experience. We discussed how fostering a mindset of gratitude can transform the way we navigate caregiving challenges, celebrate progress, and prioritize self-care. I also hope that you grabbed your free gratitude journal. Today we're shifting gears to another important role, the Caregiving Hat Medical Coordinator. As caregivers, one of our primary responsibilities is managing the complex medical needs of our loved ones. We'll explore practical strategies for managing medical appointments, keeping track of medications, and ensuring clear communication with healthcare providers. As caregivers, we wear many hats, and one of the most critical is the role of medical coordinator. This role involves juggling medical appointments, medication, treatments, and ensuring that our loved ones' care is comprehensive and consistent. It's an essential part of caregiving that requires organisation, clear communication, and a deep understanding of our loved ones' medical needs. Managing the healthcare of a loved one is not just about showing up for appointments, it's about making sure nothing falls through the cracks. Advocating for the best possible care and ensuring that our loved ones' well-being is at the centre of every decision. Let's break down the core areas that make up the medical coordinator role. Number 1, managing medical appointments. The first key responsibility is managing and coordinating medical appointments. Depending on your loved one's health needs, that can involve scheduling regular checkups, follow-up appointments, specialist consultations, lab work, and more. It's not uncommon to have multiple appointments in a week, and keeping track of everything can feel overwhelming. Here are a few practical tips to help you stay organised. Create a centralised calendar. Whether you prefer a paper calendar, a planner, or a digital tool, it's crucial to have all appointments in one place. You can use an app like Google Calendar or Apple Calendar app, where you can set reminders, colour code appointments, and even share the calendar with other family members or healthcare providers. We need to plan ahead. When you know you have several appointments coming up, planning ahead by checking which appointments can be grouped on the same day or in the same location. This can help minimize trips to the doctor and save time and energy. Prepare for each appointment. Before each appointment, review any questions or concerns you want to bring up with that doctor. Write them down so you don't forget, and bring a notepad or device to jot down any key takeaways during the appointment. Being prepared helps make the most out of each visit and ensures that nothing important is overlooked. Number 2, taking medication and treatments. Medications are another major component of the medical coordinator hat. Keeping track of what medication your loved one is taking, when they are to be taken, and any potential side effects can be challenging, especially when managing multiple prescriptions. Here are a few ways to stay on top of medication. Use a medication tracker. There are apps designed specifically for medication tracking, such as MediSafe or MyTherapy. These apps allow you to input the medication name, the dosage, the frequency, and set reminders. Some even provide reports that you can share with your healthcare provider. Keep a medication log. If you prefer something more tangible, keep a medication log. This can be a simple notebook where you track what medications are being taken, the dosage, and any notes on how your loved one is responding to the medication. Set reminders. If managing time-sensitive medication, consider setting alarms on your phone or using a pill box used with a built-in timer. This helps ensure that doses are not mistaken or taken late. Tracking medication can also include monitoring how your loved one is responding to their treatment plan. Take notes of any side effects or changes in behaviour and bring these observations to your next medical appointment. Your role as a medical coordinator includes being the eyes, ears for healthcare providers when they are not present. Number 3, ensuring clear communication with healthcare providers. Effective communication is key when coordinating care between multiple healthcare providers. Whether it's sharing information between your primary care physician and a specialist or clarifying details about a new treatment, clear communication ensures that everyone is on the same page. Here's how to stay on top of communication with healthcare providers. Be the liaison. As the medical coordinator, you're often the go-between for your loved one and their healthcare team. Take detailed notes during appointments and ask for clarification if something is unclear. After each appointment, review your notes and make sure that any follow-up steps are taken. Ask questions. Never hesitate to ask questions, no matter how small they may seem. If a doctor prescribes a new medication, ask for possible side effects and or interactions with the existing medication your loved one takes. If a procedure is suggested, inquire about the benefits and the risks. Your role is to advocate for your loved one's well-being, and asking questions is an essential part of that. Build relationships with providers. Over time, building relationship with healthcare providers can improve communication and the overall caregiving experience. Healthcare teams are more likely to work collaboratively with caregivers when they feel respected and involved. Make it a point to get to know the nurses, doctors, and other providers who care for your loved one. Number 4, keeping records and documentation. Another key aspect of being a medical coordinator is maintaining thorough records. Having all the necessary medical documentation organised and accessible is crucial for effective caregiving. Here's what you can do. Create a medical binder. Keep all essential medical information such as a treatment plan, test results, prescriptions, and insurance paperwork in one place. You can create a binder or use a digital tool like Google Drive or Evernote to store scanned copies of documents. Organising these records makes it easy to reference them during appointments. Log medical history. Document any significant events, surgeries, hospitalizations, or changes in health status. This information can be invaluable for healthcare providers in understanding the full picture of your loved one's medical history. Share the information. In case of emergencies, have a summary of your loved one's medical history readily available. It can be a lifesaver. Consider creating a one-page summary that includes key medical conditions, allergies, current medications, and contact information for healthcare providers. Now I'd like to share a personal story from my own caregiving journey that highlights the importance of the medical coordinator role. When my loved one was first diagnosed with a chronic condition, it was overwhelming to manage all of the new appointments, medications, and treatments. There were times when it felt like a full-time job just to keep track of everything. But over time, I developed a system that worked for me, a combination of digital calendars, medication tracking apps, and detailed notes. One particular moment stands out. We had an important appointment with a specialist that had been months in the making. I had reviewed all of my notes beforehand, and during the appointment I asked a critical question about a possible side effect from one of the medications. The doctor looked surprised. It turned out that this side effect was rare but significant, and had we not discussed it, I could have missed it. This experience reaffirmed the importance of being prepared, organised, and proactive as a caregiver. Number 5, preparing for the unexpected. One of the realities of caregiving is that medical needs can change unexpectedly. As a medical coordinator, it's important to be prepared for sudden changes in health, such as an emergency hospital visit or a change in the treatment plan. Here's how to prepare for the unexpected. Have an emergency plan. Know which hospital or clinic to go to in case of emergencies. Keep contact numbers for your loved ones' doctors and specialists readily available, and ensure that any emergency caregivers are aware of this information. Create a go bag. Prepare a go bag with essentials like medication, insurance cards, medical history, a change of clothes, and snacks. In an emergency, having a pre-packed bag will make transitions smoother and less stressful. Stay flexible. Despite your best efforts, there will be moments when things don't go according to plan. As a medical coordinator, it's essential to stay adaptable and flexible when managing care. Being open to adjustments can help you better navigate the ups and downs of the caregiving journey. As we wrap up today's discussion on the caregiver hat of medical coordinator, I want to acknowledge the immense responsibility that comes with this role. It can be challenging and at times overwhelming. But by staying organised, asking questions and advocating for your loved one's well-being, you can make a significant difference in the quality of care they receive. Remember, you are not alone in this journey. Lean on your support system, seek help when needed, and give yourself grace as you continue to balance the many aspects of caregiving. In our next episode, we're exploring micro moments of self-care. Those small, meaningful actions that can make a big difference. We'll cover the importance of self-care, how to take baby steps into this journey, and ways to prevent guilt or overwhelm from creeping in. Thank you for joining me on this episode of Radiant Moments. If this discussion resonated with you, please subscribe, share with other caregivers, and feel free to reach out. I'd love to hear your thoughts and experiences. Until next time, stay radiant, stay empowered, and keep shining your light bright.